What's going on, everybody? Welcome to E3 Rehab. Today we're going to discuss the diagnosis, assessment, and treatment of sacroiliac joint or SIJ dysfunction. Let's get into it. I do quickly want to state that this discussion isn't necessarily geared toward traumatic injuries or pain associated with pregnancy. So what is the sacroiliac joint? It's commonly referred to as the pelvis, as it's the connection between your sacrum, kind of the base of the spine, and innominate bones. It's quite a sturdy joint with all of the surrounding muscles, ligaments, and connective tissue, as well as the bony congruency, so it really aids in supporting the trunk and upper extremities. However, it does allow for some degree of movement, which is beneficial for the transfer of load between the spine and lower extremities, and we'll look at more specific numbers in a bit. One of the most common things that physical therapists or other healthcare practitioners do is try to implicate a specific tissue or region as the cause of somebody's pain. In this case, we're specifically looking at the sacroiliac joint. So in 2005, Mark Laszlo et al. Set out to determine if we could say that the SIJ is the cause of pain for certain individuals based on a series of tests. These provocation tests included thigh thrust, distraction, compression, and sacral thrust. He then went on in 2008 to further refine his algorithm of trying to help rule in or rule out the SIJ. We know that the joint is highly innervated based on anatomical studies, so it makes sense that it can contribute to someone's experience of pain. I use the word contribute here strategically, as Laszlo originally referred to these tests as being able to identify the SIJ as the pain generator in his seminal paper. However, with the plethora of research at our fingertips, we now know that pain is better described as an experience influenced by a multitude of factors, rather than simply having a linear correlation with tissue damage. Regardless, for now, after the provocative tests are deemed positive, the standard route of care involves assessing symmetry and pelvic alignment, or lack thereof, and dynamic testing to objectify aberrant movement patterns. Then, once these are identified, whether they are upslips, downslips, torsions, etc., it is commonplace to employ a strategy that aims to correct these various functional impairments. Therefore, the treatment algorithm is as follows. Implicate the SIJ as the source of pain using these various provocative tests, identify the associated dysfunctions, and then fix these abnormalities for symptom resolution. Before we get to treatment, we have to determine how useful these tests are in determining these various deviations. Can we accurately pinpoint asymmetries in alignment and motion? Reviews by Vander Wolf and Stovall show us that these tests are unreliable and invalid for their previously described purposes in the management of SIJ-related issues. This is not a knock on the skill of clinicians. The SIJ rotates just a few degrees and moves only millimeters in all directions when measured in people using radiostereometric analysis, the consensus gold standard for accurately quantifying movement in this region. I want to emphasize the amount of translation one more time. Millimeters. We cannot expect to see or feel these minuscule changes with our hands or with our naked eye. Expanding on this topic, it also makes sense then that manipulation of the SIJ doesn't actually alter joint positioning because it is so stable, and this was measured by Tolberg and colleagues over 20 years ago. If we can't mobilize or stabilize the SIJ due to its inherent anatomical characteristics, it stands to reason that our treatment choices don't necessarily matter, right? Yes and no. Anything can potentially work, and this is where the beauty lies. It allows for infinite possibilities, but should be applied within the context of the interventions that are going to provide the most long-term benefit for the person experiencing pain. Reassurance that function can improve with the right plan of care, and discussions around recognizing and modifying factors that might be contributing to symptoms or limitations. With respect to exercise, the goal should be to improve the capacity and tolerance of the entire person and grade it toward returning to meaningful activities. Things that load the region include squats, deadlifts, lunges, planks, side planks, bridges, hip thrusts, and the list goes on forever. However, the key is utilizing movements that pertain to the person's goals, finding an entry point, and gradually building up over time. So let's give a quick example. A trail runner takes a misstep during one of their training sessions that now limits them from performing any single limb stance, including walking, without experiencing symptoms in the region of the SIJ. Step 1 might be swapping out trail running for another form of cardio that doesn't aggravate the area. This could be biking, swimming, rowing, or anything else that's tolerable for the person so they can maintain fitness as they rehab. The next step is developing a plan with the end goal in mind, trail running. The hardest thing about this might be the impact of landing on a single leg. End stage rehabilitation, aside from running, might involve things like single leg bounds or other high level activities. Go backwards from there until an entry point is found. You might have to start with something as simple as double limb squats. No problem. You've identified the start, squats, and endpoints, single leg bounding. Fill in the gaps by gradually incorporating and progressing walking, running, and single leg work until trail running is resumed. I hope you all found this video useful. It was inspired by a recent paper titled Changing the Narrative in the Diagnosis and Management of Pain in the Sacroiliac Joint Area by Paulson and some really fantastic authors. We'll put a link to it below so you can check it out. This paper was also reviewed in this month's issue of Physio Network by Robin Kerr. Physio Network is the sponsor of our podcast, and each month they put out reviews on the most relevant topics related to physical therapy practice. And it's just a nice way to help keep up with the research, so you can read these reviews or listen via audio format. And they also have video master classes. So if you want to check them out, you can look at the link in our bio as well. Thank you so much for watching. Please hit the like button, subscribe, and leave some feedback in the comments below to let YouTube know you're enjoying the content so we can empower as many individuals as possible. Thanks for watching. Peace.